If you are pregnant and using any substance right now, I want to say this clearly. You deserve support, not shame. You are not a bad person. You are a person in a hard moment, and you can take the next right step. This video is organized by substance category. For each one, I will cover 3 things: why it can harm pregnancy and the baby, what long-term consequences can look like, and how to quit in a way that is realistic and safe. Before we start, one safety rule that can save lives. Some substances can be dangerous to stop suddenly. If you're using alcohol daily, benzodiazepines like Xanax, Klonopin, Ativan, or Valium, or opioids like fentanyl, heroin, oxycodone, hydrocodone, or methadone, do not quit cold turkey by yourself. Withdrawal can be medically dangerous. The safest path is medical support, a supervised taper, or medication-assisted treatment, depending on the substance. Now let's begin. Chapter 1. Nicotine and tobacco. Nicotine includes cigarettes, vaping, chewing tobacco, and nicotine replacement like gum, patches, and lozenges. Why it is harmful in pregnancy. Nicotine tightens blood vessels. That reduces blood flow and oxygen delivery to the placenta. Cigarettes also contain carbon monoxide and other toxins that lower oxygen even more. Long-term consequences. Nicotine and smoking are linked with higher risk of low birth weight, fetal growth restriction, preterm birth, and placental complications. There is also higher risk of breathing problems for the baby later on. Some research suggests possible later attention and behavior issues, although it is not always possible to separate nicotine from other factors. How to quit. Make a plan, not just a wish. Pick a quit date in the next 7 days. Remove products, lighters, chargers, and anything tied to the ritual. Expect cravings to rise, peak, and then fall. Replace the hand-to-mouth habit with something specific, like water with ice, mints, sour candy, a straw cup, or a fidget. If you are vaping, stepping down nicotine concentration in a planned way can help. If you are considering nicotine patches or gum during pregnancy, talk to your OB, because for many people, nicotine replacement can be safer than smoking, but it should be personalized. Chapter 2. Alcohol. Why it is harmful in pregnancy. Alcohol crosses the placenta. The fetus cannot process alcohol the way an adult can, so exposure can be stronger and last longer. There is no known safe amount of alcohol during pregnancy. Long-term consequences. Alcohol exposure can cause fetal alcohol spectrum disorders. That can include growth issues, learning and memory problems, attention issues, impulsivity, and lifelong challenges with executive function. How to quit. If you drink daily or you binge drink, do not stop alone. Alcohol withdrawal can be dangerous. Contact your OB, your primary care doctor, or an addiction medicine program and tell them you are pregnant and need a safe plan. If your use is occasional but you keep slipping, remove alcohol from your home, avoid social events tied to drinking for a while, and replace the ritual with a specific non-alcoholic drink and a new routine. Chapter 3. Cannabis and THC. This includes marijuana, weed, joints, blunts, bowls, vapes, carts, dabs, concentrates, and edibles. It also includes Delta-8 and similar products. Why it is harmful in pregnancy. THC crosses the placenta and may affect fetal brain development. Smoking cannabis adds combustion toxins, similar to smoking tobacco. And there is another part that people do not talk about enough. Contaminants. Cannabis products can contain pesticide residues, fertilizer residues, mold, and heavy metals. The cannabis plant can absorb substances from soil, and concentrates can concentrate contaminants too. Risk can be higher with unregulated products, but contamination can happen in many settings because you cannot see or taste it. Long-term consequences. Research links prenatal cannabis exposure with higher risk of low birth weight and preterm birth. Evidence on long-term neurodevelopment is mixed, but there are concerns about later attention, memory, and behavior. Contaminants add another risk pathway. Heavy metals and certain pesticides are known in toxicology to be risky for brain and organ development, and a fetus is more sensitive to toxins than an adult. How to quit. Expect irritability, sleep disruption, appetite changes, anxiety rebound, and vivid dreams. If you used heavily every day, a short taper over 1 to 2 weeks can be more realistic than stopping overnight, especially if stopping abruptly makes you relapse. Replace the ritual, not just the substance. If nights are your trigger, create a set routine like shower, tea, snack, a calming show, and bed. If nausea is your trigger, Talk to your OB about pregnancy-safe nausea treatments instead of trying to treat it with THC. Chapter 4. Opioids. This includes heroin, fentanyl, oxycodone, hydrocodone, morphine, and any pills that could be pressed or contaminated. Why it is harmful in pregnancy. Opioids can cause fetal dependence. After birth, the baby can experience neonatal opioid withdrawal. Illicit opioids also carry overdose risk, especially with fentanyl contamination. Long-term consequences. Higher risk of preterm birth, poor fetal growth, stillbirth, and longer NICU stays. Overdose risk is a major threat to the mother, and therefore to the pregnancy. How to quit. Do not quit opioids suddenly on your own. The safest evidence-based approach for opioid use disorder during pregnancy is medication-assisted treatment, usually buprenorphine or methadone, plus prenatal care and counseling. This is not replacing one drug with another. It is stabilizing the body, preventing withdrawal, and reducing overdose risk. If opioids were prescribed and dependence formed, the plan is usually a medically supervised taper. If there is any overdose risk, ask about naloxone and never use alone. Chapter 5. Benzodiazepines. This includes Xanax, Klonopin, Ativan, and Valium. Why it is harmful in pregnancy. Benzos cross the placenta. They can cause neonatal sedation and in some cases withdrawal after birth. Combining benzos with opioids increases overdose risk. Long-term consequences. Newborn adaptation issues can include feeding problems, sleepiness, and breathing concerns in the early days. Data on long-term outcomes is mixed, but dependence and polysubstance risk are serious. How to quit. If you are using benzos regularly, do not stop suddenly. Withdrawal can include seizures. The safest approach is a slow taper supervised by a prescriber. Some clinicians switch to a longer-acting medication first, then taper gradually. Pair the taper with real anxiety supports like therapy, sleep stabilization, breathing skills, and other pregnancy-safe options if your doctors recommend them. Chapter 6. Cocaine and crack. Why it is harmful in pregnancy. Cocaine causes intense blood vessel tightening that can reduce placental blood flow and oxygen. It also raises blood pressure and increases risk of placental abruption, which can be life-threatening. Long-term consequences. Higher risk of preterm birth, poor fetal growth, placental abruption, and stillbirth. Some studies report later attention and behavior issues, but many factors overlap. How to quit. Stop now and get support. Cocaine withdrawal is usually not medically dangerous like alcohol or benzos, but cravings can be intense and mood can crash. Cut off access, change contacts, avoid high-risk environments, and build daily accountability. Counseling helps. Some programs use contingency management, which can be very effective. If you feel paranoia, severe depression, or thoughts of self-harm, seek urgent help. Chapter 7. Methamphetamine and other illicit stimulants. Why it is harmful in pregnancy. Meth raises heart rate and blood pressure and stresses the placenta. It can worsen sleep, nutrition, and hydration, which all matter for pregnancy. Long-term consequences. Higher risk of fetal growth restriction, preterm birth, and placental problems. Babies may need NICU care more often. Some studies suggest possible later learning and behavioral effects. How to quit. Get help quickly. Withdrawal can bring severe fatigue, depression, and suicidal thoughts. Even if withdrawal is not usually physically dangerous, the mental health crash can be. Prioritize safety, sleep, nutrition, hydration, and professional support. If you are using stimulants to cope with ADHD or trauma, treat the underlying issue with clinicians instead of self-medicating. Chapter 8. Prescription stimulants. This includes Adderall, Vyvanse, Ritalin, Concerta, and similar medications. Why it can be harmful in pregnancy. The biggest risks show up with misuse, high doses, or patterns that wreck sleep, appetite, and blood pressure. Pregnancy already stresses the cardiovascular system, so uncontrolled blood pressure and poor nutrition matter. Long-term consequences. With misuse, there can be higher risk of poor fetal growth and preterm birth. For the parent, long-term consequences can include anxiety, insomnia, cardiovascular strain, and addiction patterns. How to quit. This one depends on context. If you are prescribed a stimulant and take it exactly as directed, the risk-benefit decision is individualized with your OB and mental health prescriber. If you are misusing stimulants or feel dependent, do not try to handle it alone. Work with your prescriber on a taper and an ADHD plan that includes structure, sleep, nutrition, and therapy supports. The goal is stability and harm reduction, not punishment. Chapter 9. MDMA and club drug mixtures. This includes ecstasy and Molly. Why it is harmful in pregnancy. MDMA can cause dehydration, overheating, and blood pressure changes. Many pills contain unknown substances. Overheating and dehydration are especially dangerous in pregnancy. Long-term consequences. Higher risk of preterm birth and poor growth is a concern. Unknown pill contents add overdose risk. How to quit. Stop and avoid party environments, at least temporarily. Replace the social routine. If this drug is tied to trauma coping, loneliness, or nightlife identity, therapy and sober community support can make quitting stick. Chapter 10. Ketamine. Why it is harmful in pregnancy. Pregnancy data is limited, but ketamine intoxication can lead to accidents, poor self-care, and risky dissociation. There are also concerns about effects on brain development based on general neuroscience. Long-term consequences. For the parent, chronic ketamine use can cause bladder injury and cognitive changes. For pregnancy, the safest choice is to avoid exposure. How to quit. Stop and get support. Build grounding skills for dissociation urges. If ketamine is prescribed medically, do not change it without talking to your prescribing clinician and OB. Chapter 11. Hallucinogens. This includes LSD, psilocybin mushrooms, DMT, and mescaline. Why it is harmful in pregnancy. Research is limited, but the risk is unpredictability. Panic, unsafe behavior, dehydration, and trauma can all happen. Some substances can affect heart rate and blood pressure. Long-term consequences. Long-term fetal effects are uncertain, and that uncertainty is part of the reason to avoid. The more immediate risks are accidents, self-harm, and missing prenatal care during altered states. How to quit. Stop and avoid triggers and settings where they are offered. If you are using psychedelics to cope with depression, grief, or spiritual emptiness, build safer supports like therapy, mindfulness practices, and clinician-guided options. Chapter 12. Inhalants. This includes huffing solvents and using nitrous oxide, often called whippets. Why it is harmful in pregnancy. Inhalants can displace oxygen. Some are directly toxic to the developing nervous system. They also carry a risk of sudden heart problems for the mother. Long-term consequences. High risk of fetal brain injury from lack of oxygen, as well as severe maternal harm. For the parent, long-term cognitive and organ damage can occur. How to quit. This is an urgent category. Get medical and addiction support. Remove access to products and involve safe support people. If you are using inhalants, treat it like a medical emergency level risk. Chapter 13. GHB and sedative club drugs. Why it is harmful in pregnancy. These drugs can cause blackouts and dangerous sedation. They increase risk of respiratory depression and assault. Dosing is unpredictable. Long-term consequences. High risk of injury, overdose, and loss of prenatal stability. Data is limited, but the risk profile is serious. How to quit. Stop and avoid contexts of use. If you suspect dependence, get medical guidance because withdrawal can be dangerous. Prioritize personal safety planning and trauma-informed support. Chapter 14. Synthetic cannabinoids. This includes spice and K2. Why it is harmful in pregnancy. These products can be far more potent than expected and can contain unpredictable chemicals. They can cause severe anxiety, psychosis, vomiting, and cardiovascular problems. Long-term consequences. Risk of acute medical crises for the mother and pregnancy risks from those crises. Fetal risk data is limited, but the unpredictability makes this high risk. How to quit. Stop immediately and get support. If you experience severe agitation, psychosis, chest pain, or uncontrolled vomiting, seek urgent medical care. Chapter 15. Polysubstance use. This means mixing substances, stacking, or cycling between them. Why it is harmful in pregnancy. Risks multiply. Overdose risk rises. Withdrawal becomes more complicated. Sleep and nutrition collapse. Prenatal care often becomes harder to maintain. Long-term consequences. Higher rates of preterm birth, poor growth, NICU stays, and maternal medical emergencies. Without a postpartum plan, relapse risk is also higher. How to quit. Prioritize medical stabilization first. Alcohol, benzos, and opioids are the categories where medical supervision is most important. Build a wraparound plan that includes prenatal care, addiction support, mental health treatment, and a postpartum relapse prevention plan. Now I want to leave you with something practical. If you are overwhelmed, do not try to quit everything perfectly in one day. Pick the next step that increases safety. Call your OB, Tell the truth. Ask for a referral to addiction medicine or maternal fetal medicine if needed. If you are afraid of judgment, bring a support person or write it down and hand it to the nurse. Getting sober in pregnancy is not just about willpower. It is about support, stabilization, and a plan. You can do this one step at a time. Now, let's talk about reaching out for support, because this is the part that changes everything. Support can look like medical care, counseling, groups, friends, family, or one safe person who knows the truth. If you have an OB or midwife, start there. You can say, "I am pregnant and I need help stopping, and I want a plan that is safe for me and the baby." Ask for a referral to addiction medicine, maternal fetal medicine, or a perinatal behavioral health program. If you are already in mental health care, tell your prescriber exactly what you are using, how often, and what you are afraid will happen if you stop. A good plan treats withdrawal risk, mental health, and relapse risk all at the same time. If you do not have a provider you trust, you can still reach out today. In the United States, you can call or text 988 if you are in a mental health crisis. And you can call the SAMHSA National Helpline at 1-800-662-4357 to find treatment, resources in your area. If you ever feel in immediate danger or you think you might overdose, call 911. If the biggest barrier is shame, I want you to hear this. Doctors and counselors have seen this before. You are not shocking them. You are not disgusting. You are asking for help, and that is a strong decision. And if you do not have anyone safe in your personal life, consider a support group. Some people do well with 12-step groups. Some prefer smart recovery. Some need a pregnancy-focused program. The format matters less than the fact that you are not doing this alone. Even one honest conversation can shift your whole pregnancy. If this video helped you feel less alone, please like and subscribe. And if you want, leave a comment with the category you want me to go deeper into next, or what part of quitting feels hardest for you right now.